Professor Lawrence Manning and I'm one of the chief investigators for the Roadmap trial. In this video, I'll explain a little bit more about the antibiotic duration part of the Roadmap trial. We call this the antibiotic duration domain. You've been asked to think about participating in the Roadmap trial and this domain because you may need to have an operation to replace your infected prosthetic joint. This kind of surgery is called revision surgery. To learn more about the surgery and the Roadmap trial in general, please find our other videos on the Roadmap website. If you've had or plan to have your infected artificial joint cleaned out but not replaced, then this domain is not relevant to you. However, at this stage, you and your treating team may not have yet decided on the surgical plan. So it's important for you to consider if you'd like to participate in this domain if you do end up having revision surgery and your infected artificial joint is replaced with a new one. The focus area of this domain is how long antibiotics are given to help with treating the infection after surgery has been completed. Antibiotics work by killing the bacteria or germ that's causing an infection, but we don't know whether taking antibiotics for a longer time is better than taking them for a shorter time to cure the infection. Revision surgery can either be done in one stage where the infected artificial joint is removed and a new one is put in at the same operation, or in two stages. In a two-stage revision, the infected artificial joint components are removed and replaced with a temporary joint replacement and cement, which is mixed with antibiotics. Then, weeks to months later, the temporary joint is removed completely and a new permanent artificial joint is put in place. After a one-stage operation, most doctors prescribe either 6 or 12 weeks of antibiotics, but we don't actually know if one of these is better than the other. In a recent randomised trial from France, 12 weeks was no better than 6 weeks, but it was a small trial, and because of this, there is still some uncertainty. If you'd like to read more about this trial, we've provided a copy on our website. If you have a one-stage revision and you agree to be part of this domain, you will be randomly allocated to take either 6 weeks or 12 weeks in total of antibiotics after your revision operation. The actual antibiotics used will be chosen by your treating team and can be one antibiotic or a few different antibiotics. This is called your backbone antibiotic, and you will have a short period of time where antibiotics are given to you intravenously. This can be anywhere from 1 to 6 weeks. After this time, your antibiotics will be switched to a tablet or capsule that you will continue to take by mouth for the rest of the time you're asked to take them. The complete time for taking the antibiotics can be either 6 weeks or 12 weeks. We will then follow you up for 12 months to ask you how you feel and to check on how well your treatment has worked. If you have a two-stage operation, it is common to give at least 6 weeks of antibiotics between the first stage operation and the second stage, where a new artificial joint is put in. Sometimes there might be several months between the first and second stage. The time between the operations and the duration of antibiotics between the two stages will be decided by your treating team and not by the Roadmap trial team. What the Roadmap trial is looking at here is whether or not there is benefit in taking antibiotics after your final operation, when the infection should have already been cured. After the second stage, it is common to stop the antibiotics if there are no signs of ongoing infection after 5 to 7 days of trying to grow the bacteria in the laboratory. A recent small trial from the United States suggested there was fewer occurrences of infection in people taking antibiotics for a further 12 weeks after the final operation. If you'd like to read about this study, we've placed it on our website. However, this has not been found in any other studies, and it's still unclear if the downsides of taking antibiotics for an additional 12 weeks outweighs any benefit, and in fact, if there's any benefit at all. That's why we're looking at this in the Roadmap trial. If you have a two-stage revision, you'll have the usual antibiotic treatment between the two stages, and then you'll be allocated to either stop the antibiotics after a few days, or be asked to continue antibiotics for a further 12 weeks. If asked to continue the antibiotics, this will usually be with oral antibiotics, in other words, tablets or capsules. Most people don't get any side effects from the antibiotics as they are generally safe, but occasionally people do. The most common side effect can be indigestion, nausea, and diarrhea. Other rare reactions include low blood counts and irritation to the liver or kidneys, and allergic reactions such as rash. Giving longer course of antibiotics may mean it's more likely for you to develop side effects, but this is not always the case. Your doctors can also help to manage these side effects if they do occur. For more information about potential side effects of taking antibiotics, please see the web link on our Roadmap website. Thanks for watching. We hope this gives you enough information to decide about participating in the Roadmap trial. Please speak to your doctor or the research team if you have any further questions. There's also a lot of additional information on our Roadmap website about the Roadmap trial and about trials in general that you can look at any time if you choose to. Thank you for considering participating in the Roadmap trial.